We've been getting a lot of questions about testing, so I wanted to spend the majority of our time talking about that. As you know, testing, tracing, and isolating are the three major functions of the health department in this phase of a pandemic, and so we take testing and tracing and isolating very important. And it all starts with testing. And so I think it's very important for you all and for our public to understand who should get tested, how to get tested, why to get tested. But the most important feature of a test, and this is true every day in medicine as well, is that when you get a test, the most important reason to get the test is that it will change what you do. There are a lot of features of this test that are still, unfortunately, falsely reassuring and falsely alarming. And so we want to make sure that people understand the meaning of tests, and the meaning of tests can be very confusing. So I want to spend some time talking about that. But first of all, let's talk a little bit about the question of how long it takes to get a test. So as you all know, as of July 1st, the State Department of Health has opened up testing essentially to them. And so we are seeing an increase in demand. Our capacity to test has to date remained adequate, although what we are seeing is select pockets of where it is taking a little longer than it had been. In general, it's taking 2 to 3 days for the majority of tests to come back. But as you know, there is significant variation in the test processing time. And that has to do with a number of factors. One of those is where the lab is drawn, whether it's in a hospital setting or in an outpatient setting. Another reason is the clinical indication. So if somebody is being admitted to the hospital, their lab is being drawn typically in the emergency room or when they arrive on the floor, and that test is processed on site, and so that can take only hours because the clinical indication is relatively urgent to understand if somebody's COVID positive or not when they're being admitted to the hospital, which is in contrast to other sites, for example, at MCC. None of those patients generally are on their way to the hospital, and so those tests can take longer. So there's a number of reasons for the variation in that, but in general, though we do see some outliers, the vast majority of tests are being done within 2 to 3 days. Currently, our number of tests is well above 1,000, and you'll recall one of the metrics for the reopening of our community in the phases was that we needed to have 30 tests per 1,000 residents per month. And so when you do the math, that comes down to about 740 tests per day for Monroe County, and we're well in excess of 741. So that is not a concern at the moment, but we certainly want to do the best we can and increase testing capacity as much as possible. So again, anybody can get a test. We in healthcare are still wanting to prioritize tests for people in whom the result will make a major change in our management. So we certainly want to know in people who are symptomatic, people who are high risk, older adults, individuals with chronic medical concerns, any children who have symptoms or who may be at risk for the multi-system inflammatory syndrome, which we have thankfully not seen very much of lately, which is good. People who are getting surgery, people who are being admitted to the hospital, people who've been in close contact with someone who is a known positive. Whether they have symptoms or not, we're going to want to test them because we know they have a higher chance of having a true positive result. Anybody in quarantine, healthcare workers, first responders, the same groups that we had been prioritizing in the past. Anybody who's an essential worker who interacts directly with the public, and so forth. So when is the right time to get tested? And this gets into the question of how do we interpret these tests? So without getting too far into the clinical epidemiology weeds, tests aren't perfect. And when you have a negative test result, that doesn't necessarily mean you don't have the target condition. When the test result comes back negative, and we know that you don't have the target condition, we call that a true negative. But unfortunately, when it happens, and it happens relatively commonly with COVID, that you get a negative test result, but you later end up having the illness, we call that a false negative. And the challenge with the tests available today in diagnosing COVID-19 is that there is a significant false negative rate. And we'll get into those numbers, but the implication of a false negative rate, false negative result, is that the person who's taking the test may derive a false sense of security. And when they have a false sense of security, they may be inclined to relax on the precautions that they might otherwise take had they not known that they had a negative result or had they not gotten tested at all. And that is of significant concern to us in public health because the safety of this community rests upon everybody taking precautions. And we certainly don't want to give anybody a false sense of reassurance, particularly one that might lead them to stop taking the precautions that we so desperately need to rely upon in order to keep one another healthy. So to give you a sense of the quantity of the false negative rate, so a couple statistics. First of all, when a person becomes symptomatic, if they become symptomatic from this virus, on the day they get that those symptoms, the false negative rate is still 38%. So 38% of people who are symptomatic on day one of their illness may still have a negative test result. When we wait 3 or 4 days later, it comes back positive, and then we can extrapolate backwards and we can conclude that the test that they had on day one of symptoms was a false negative. So as you can imagine, it's not a perfect test, even when you have a confirmed infection. We know that the test performs the best 8 days after the onset, or 8 days after the person gets infected. And that sounds like a long period of time. Again, some people may or may not get symptoms, but that is the date on which the test is most likely to be reliable, i.e. still have a higher true positive rate and the lowest false negative rate. So to keep a long story short, the point of this is please do not be falsely reassured when you have a negative test result. A positive test result is also somewhat confusing because we know that many people who have this infection have an asymptomatic course. When you have a positive test, it doesn't mean that you're infectious today if you're asymptomatic. If you have a positive result and you're symptomatic, it's highly likely that you're currently ill, currently contagious, and at greater risk for spreading the infection. But because so many people have an asymptomatic course, and because the test can remain positive for 6 to 8 weeks, you can get a positive result long after you've cleared the illness from your body. And so that is the other confusing part about a positive test. The other question that often comes up is, if I'm under quarantine and I get a negative test result, does that mean I can come off of quarantine? And the answer is no, because what determines your status on quarantine is your exposure to a high-risk contact. And we need to wait the 14-day incubation period from the date on which you contacted that person to ensure that you've gone through the period of when you would be expected to be contagious and possibly have symptoms. And so having a negative result does not necessarily mean you are free to move about the county. So a question that often comes up is, how often should you get tested? You could get tested every day. The reality is that we don't have the capacity for that, and there's really no good reason for that, but there's really nothing stopping you from doing that if you're able to get tested every day. Realistically, what we tell people is, if you really want to know, every week is more than adequate. Healthcare workers, people who work in nursing homes, essential workers, and so forth, testing every week is currently the recommendation for how frequently to get tested if you're at high risk or have high concern. And then as far as how long it should take, 2 to 3 days is the typical average. But that being said, we've seen examples of 10 to 14, sometimes even longer. And that typically results from having the specimens sent out to what we call a reference lab, which is typically out of state.